All right, good afternoon, everyone. I am Dr. Wendy Cotton, serving as the co-chair of this advisory committee for today's dissertation defense, proposal defense. Kindly ensure your cell phones are on vibrate and please mute your Zoom microphones. It is important to note that this session is being recorded. Okay, making sure it's recording. The purpose of today's defense is to give the doctoral candidate an opportunity to present her research, demonstrating a thorough understanding of the subject matter. This presentation will allow her to articulate each aspect of the research process, fulfilling the academic requirements for the Doctor of Philosophy degree. This committee selection process involves a collaborative consultation between the student, the advisory committee, and the chair. A doctoral dissertation committee must consist of at least 4 members, which may include 1 member from outside the program, subject to approval by the academic dean. The majority of the committee must be composed of Hampton University faculty. For the Department of Education, all members must hold a terminal degree, and the committee chair must be a Hampton University faculty member within the discipline. Thought I admitted everybody. The advisory committee is tasked with ensuring that the dissertation meets rigorous research standards. We are responsible for approving the research topic and methodology, and we meticulously review and provide detailed feedback on manuscript drafts, assessing the validity and quality of data and evidence presented. Our collective effort ensures that each candidate is thoroughly prepared for the oral examination and defense of his or her research. Before proceeding further, we would like to take a moment to express our sincere gratitude to the committee for their dedicated efforts, valuable insights, and unwavering commitment to supervising this research. Your guidance and support have been instrumental in helping the candidate navigate the complexities of this research journey and achieve this significant milestone. Your personal investment in both the academic and professional development of the candidate has not gone unnoticed, and we deeply appreciate the time and expertise you've brought to this process. Allow me, please, to introduce the esteemed members of this committee. Dr. Denise Charbonnet, Associate Professor, Department Chair, and the Chair of this Advisory Committee. Dr. Wendy Cotton, Adjunct Assistant Professor in the Department of Education and Counseling and Co-Chair of the Advisory Committee. Dr. Stephanie Johnson, Adjunct Assistant Professor in the Department of Education. She is also the former program coordinator for this department. And Dr. Ivy Lee, Adjunct Assistant Professor in the Department of Education and Counseling. We would also like to take a moment to acknowledge any university officials who may be present. Dr. Abel Fulp, not sure that she's here. She's Assistant Professor and Education Program Director. Before I introduce the candidate, let's take a few minutes to review the process for the oral defense. The candidate will begin by introducing herself and providing an overview of her academic and professional credentials. Following the introduction, Following this introduction, she will present her research proposal focusing on its relevance and significance. The presentation will cover key elements such as the introduction, statement of the problem, theoretical frameworks, research questions, and methodology. After the candidate's presentation, the co-chair or the chair will invite questions from the committee and as well as any university officials who are present. After the oral defense, guests can remain in the main room with the candidate while the advisory committee deliberates in a separate room. During this time, the committee will evaluate the candidate's performance on the examination. The final outcome will then be communicated to the candidate as well as to Hampton University Global, Department of Education, the School of Liberal Arts. Depending on the committee's decision, the candidate will be required to follow Hampton University's established guidelines to complete the final steps necessary for the degree. Colleagues and guests, I present to you Miss Katrina Hunt. I'm sorry, Miss Lynise James. I'm reading from the wrong script. Miss
Thank
Lynise
you.
James.
Thank you, Dr. Cotton. Good afternoon to everyone. So before I get started, I just want to say thank you to my dissertation advisory committee, especially for your unwavering support and just the thorough revision process that I've had over the past couple of years. And just thank you for being here today. Your expertise has truly made this such an invaluable learning experience, and I've grown so much over the past 4 years in this program. So this dissertation is entitled General Education Teacher Attitudes Toward Autism Inclusion in Secondary Charter Schools. And I'm excited to present my dissertation research proposal, as this study is a culmination of my academic journey and just a passion for promoting inclusive educational practices. I received a bachelor's degree in political science, minoring in Asian studies and social welfare at Buffalo State University, and my master's in secondary education at Hunter College. And I'm also currently pursuing a certificate in applied behavioral analysis alongside this doctorate. And my career started out as a special education teacher in the STEM subjects in New York City and also in Atlanta. And then I pivoted to the nonprofit industry for a while, only just to find myself back today in such a rewarding school year that I've had as a middle school math teacher in Washington, D.C. This study seeks to extend prior research by examining general education teachers' cognitive, affective, and behavioral attitudes toward including students with mild to moderate autism in secondary charter schools. So using a correlational quantitative design, it explores whether years of teaching experience, years of inclusive teaching experience, exposure to applied behavioral analysis training, and teacher minority status predict teacher attitudes toward inclusion. And the findings may inform sustained professional development models that strengthen teacher confidence, instructional competence, and just effective behavioral support in inclusive classrooms. So historically, students with disabilities were separated from general education until the civil rights movement led to that legislation, such as IDEA, that mandated that inclusion in the least restrictive environment. And despite that progress, however, there has still been biases and challenges that are based on that implementation that still remains. And in New York, charter school enrollment, including students with disabilities, continue to rise, yet many teachers report limited training, particularly in ABA-informed supports to effectively meet the standards of those students with ASD. And this study partially replicates and it extends DiMaggio's 2020 research by now examining only general education teachers' cognitive, affective, and behavioral attitudes toward inclusion of students with ASD within that urban charter high school sector in New York. And using the attitudes toward teaching all students modified instrument, it's going to explore whether years of teaching, years of inclusive teaching experience, exposure to ABA training, and teacher minority status predict those attitudes towards inclusion. Particular emphasis is placed on the ABA training as a structured professional development variable, while also examining whether teacher demographic identity is associated with inclusive attitudes. The prevalence now of autism spectrum disorder has increased, and that results in just more students with ASD being educated in that general education setting under those federal inclusion mandates. Now, despite this shift, many general education teachers report limited preparation to effectively support those students, while special education programs often provide some targeted training in evidence-based practices, such as ABA. And general education teachers frequently receive minimal ASD specific instruction. Additionally, limited research has examined how professional experience, ABA exposure, and just teacher minority status relate to attitudes toward inclusion in secondary charter school settings. And this gap underscores the need for this present study. The study is significant because it focuses on that secondary charter schools in New York, which is a rapidly growing sector that is increasing the enrollment of students with ASD. And research shows that teacher attitudes toward inclusion are associated with student success in the least restrictive environment. By examining these attitudes, the study may inform targeted professional development efforts aimed at improving instructional practices and reducing those disparities. So this study is grounded in social cognitive learning theory, which emphasizes how beliefs about one's capabilities influence behavior. Central to this theory is the teacher self-efficacy, or the confidence piece, in effectively supporting all students, including those with ASD. So the higher the self-efficacy, it is linked with stronger instructional practices and classroom management, while lower self-efficacy may hinder effective inclusion. And in the study, self-efficacy helps to explain how teachers' perceived competence shapes their cognitive, affective, and behavioral attitudes toward inclusion. The second theoretical framework is implicit bias theory, which examines how those unconscious beliefs influence decision making. In schools, implicit bias can shape how teachers interpret behavior, how they set expectations for students in the classroom, and how they support those students with disabilities. So when unexamined, these biases may contribute to the inequitable outcomes within the classroom. And this framework helps to explain how underlying perceptions may influence teacher attitudes toward students with ASD in that inclusion setting. So the research question for this study are as follows. Research question 1, what are the cognitive attitudes of secondary general education teachers toward including students with ASD in urban charter schools? What are the effective attitudes of secondary general education teachers toward including students with ASD? Research question 3, what are the behavioral attitudes of secondary general education teachers toward including students with ASD? 4, to what extent does the number of years teaching in an inclusive environment affect teacher attitudes toward students with autism? Research question 5, to what extent does the ABA training exposure significantly predict a variance in attitudes toward inclusion across the cognitive, affective, and behavioral subscales? Research question 6, to what extent does teacher minority status, so minority versus non-minority, significantly predict a variance in attitude toward inclusion across the cognitive, affective, and behavioral subscales? So this study is limited to urban charter high schools within New York State, and it excludes the traditional public schools, private schools, non-charter school settings. And the participants are certified general education teachers with valid 7 to 12 certifications, currently teaching grades 9 to 12. So middle school teachers will be excluded, and special education teachers, other uncertified staff, elective teachers, and just non-instructional personnel are also excluded to maintain that focus of examination on the general education teacher attitudes in that charter school context. My definitions of terms are as follows. Affinity bias, that captures the essence of habit and familiarity. Attribution bias, a bias that impacts the inclusive and equitable treatment of difference. Applied behavioral analysis, or ABA, is an evidence-based practice that uses principles of learning like reinforcement, prompting, shaping, and data collection to increase helpful behaviors and reduce challenging ones. It is one of the most effective interventions for supporting students with ASD on that academic, social, and inclusive settings. Autism spectrum disorder. It is a neurodevelopment disorder that manifests in communication, socialization, and behavioral differences. The least restrictive environments mandates that whenever possible, children with disabilities should be educated alongside their non-disabled peers in a regular education setting. And secondary education, and for the purpose of this study alone, secondary education is going to refer specifically to certified general education teachers licensed in New York State for grades 7 to 12 who are currently teaching high school, grades 9 to 12, within the urban charter school setting. So although New York State secondary certification encompasses grades 7 to 12, this study is going to just be limited to that 9 to 12 educators. This literature review is organized around 6 core components: teacher attitudes toward inclusion, social cognitive learning theory, and self-efficacy, the cognitive, affective, and behavioral components of attitudes, the role of ABA training and professional development, the unique variability within charter school, high school contexts, and the research gaps in secondary settings that justify this study. So teacher attitudes toward a student with ASD directly impact that classroom climate and just the success of inclusion. And positive experiences build confidence, while limited preparation can create or cause hesitation. And the social cognitive learning theory emphasizes self-efficacy, showing that teachers who believe that they can actually manage that instructional and behavioral challenges that might arise are more likely to use evidence-based strategies. And structured professional development play a key role in strengthening that confidence and supporting effective inclusive practices. The study also uses a tri-component model to examine teacher attitudes across the cognitive, affective, and behavioral dimensions of the ATTAS instrument. The cognitive domain that reflects the beliefs about ASD. The affective domain captures the emotional responses toward inclusion, and the behavioral domain represents the instructional intentions. So because many general education teachers receive limited ASD-specific preparations, which emphasizes reinforcement and data-driven practices, ABA training may strengthen these attitude components and improve inclusive implementation. Now, research shows that implicit bias can influence teacher expectations and disciplinary decisions, affecting that inclusive setting. So while ABA promotes data-driven practices, training is not constantly provided. The teacher's racial or ethnic identity may also shape those perceptions, yet there's limited predictive research that examines minority status in secondary charter schools. So combined with the high turnover and the inconsistent professional development, this reveals that there's a significant gap that this study addresses. The study uses a quantitative and non-experimental correlational design to examine teacher attitudes on a cognitive, affective, and behavioral domains towards the inclusion of students with ASD within the classroom using that ATTAS instrument. And research questions 1 to 3 are going to be analyzed using descriptive statistics. Research question 4 will use a hierarchical multiple regression to assess the impact of teaching experience. Research question 5 and 6 are going to use that standard multiple regression to determine whether ABA training exposure and teacher minority status predict a variance in each attitude subscale, controlling for experience at an alpha level of 0.05. Now, this study will be conducted in the urban charter high school system in New York State. Participants will include full-time general education teachers with that valid 7 to 12 certification, teaching grades 9 to 12. A non-probability snowball sampling method is going to be used to target a sample of approximately 75 to 82 teachers to support that regression analysis. And special education teachers, middle school teachers, elective administrators, uncertified staff, and just incomplete responses are going to be excluded from this study. The data will be collected using SurveyMonkey and analyzed with Python software. Statistical methods are going to identify the patterns in which teacher attitudes align with the three subcomponents, providing insights into relationships between those trainings and between attitudes and between inclusive practices. And as aforementioned, the survey responses will be analyzed using descriptive statistics to summarize that cognitive, affective, and behavioral attitude score. So the hierarchical and multiple regression analysis will then examine whether teaching experience, inclusive experience, ABA training exposure, and teacher minority status will significantly predict a variable or a variance in the attitudes toward inclusion. Now, all of the analysis are going to be conducted at a alpha level of 0.05 with effect sizes, confidence intervals, and diagnostic assumption checks reported within the testing. This slide summarizes the content that is within that ATT-AS instrument. The questions are split to comprise the three components of attitude, and those are the cognitive, affective, and the behavioral components. So specifically now, this instrument, the ATT-AS survey, it was developed by Gregory and Noto in 2012 to measure the general education teacher attitudes towards inclusion. And the instrument includes a biographical questions that are on a 9-item Likert scale. And they also include the survey that's assessing those three subscales on a 9-item Likert scale as well, where there is a 7-point Likert scale demonstrating agree very strongly to disagree very strongly throughout the different dimensions of the subscale. And there will be an additional demographic item added to the first part of the survey that categorizes that teacher racial or ethnic identity into minority versus non-minority status for that regression analysis. The instrument's validity was established through evaluations, pilot testing, and statistical analysis, and achieved a high reliability with a Cronbach's alpha of 0.08, assessing the reliability across those three dimensions. And the cognitive subscales for item 1 to 3 will evaluate the beliefs about students' success in general education settings. The emotional subscale or the affective subscale, those are items 4 to 6, and that measures the relationships, while the behavioral subscales, items 7 to 9, is going to assess the inclusive teaching practices. And together, these subscales capture the cognitive, the affective, and the behavioral attitudes. So the research adheres to ethical standards that are sanctioned by the Institutional Review Board at Hampton University, adhering to the ethical guidelines and ensuring that participant confidentiality and involuntary involvement. The data is going to be anonymized and securely stored with all of the findings reported transparently. So in summary, this study examines general education teachers' attitude towards including students with ASD in that urban charter secondary school setting. And by analyzing the cognitive, the affective, and the behavioral components of attitudes, the study is going to explore how those factors may influence the inclusive practices. And the findings are going to aim to contribute to the development of target professional development models that strengthen the teacher preparedness, strengthen teacher confidence, and also just the overall effectiveness and inclusive educational settings. And these are a few of the references, just a snapshot. And now Dr. Cotton will moderate the question and answer session. I look forward to your insight and your feedback. Thank you.
Thank you so much, Miss James. Thank you for such a phenomenal, very comprehensive review of your research proposal. So now we will open the floor to the committee for their questions and inquiries, comments, and so forth. And we'll start with Dr. Stephanie Johnson.
Good afternoon. I'm so impressed with the quality of your voice. You did a beautiful job of making that presentation, Lynise.
Superintendency
I have
has
two questions.
joined the meeting.
I I have two questions. The first question is why did you specifically choose the charter schools as the setting for your study now? When you answer, please remember that I've never been in a charter school or worked with a charter school, so I need to hear from you why you chose it.
Yeah, so I chose the charter school setting, specifically the urban charter school setting, because they have a rapidly increasing enrollment and they also operate under a different structure than the traditional public school will, which means that they have a lot more flexibility when it comes to implementing certain learning programs for professional development. I sat in on a meeting once, and the administrators asked their staff members to let them know if they have any ideas for different professional developments that they would like to have implemented within the school year or different skills that they would like to learn. So I think or believe with that flexibility, it allows for more changes to happen on a faster and more influential basis than with the public schools.
Thank you. And the last question is what factors do you believe have contributed to the increase in autism diagnosis in recent years?
I believe that there are a couple factors. One being the awareness has increased, especially with social media. There are many different groups where those medical professionals are reaching out to parents and just, anyone who would listen on the behaviors to look for, the different socialization skills and the communication skills that might be lacking at a certain age of a parent's child. And if they do see those things, maybe they should get early testing. And there are also just other groups with parents who are discussing that as well. There's also with that awareness, people are also more open to speaking about their diagnosis. As to prior years, it was taboo to have a diagnosis of such magnitude where your child might get labeled and this label can stay with them forever throughout their K-12 existence. But now it seems that because of the awareness, a lot of people are more open and honest about what is truly going on with themselves and with their children. And there's also been a push from the CDC for pediatricians to do that early stage screenings so that parents can now get that early intervention. And prior to 2013, there was Asperger's, there was autism, and there was a pervasive developmental disorders that were all separate diagnoses. And after 2013, they have combined it, now expanding the behaviors that are under that umbrella, truly making it a spectrum.
Thank you. What beautiful answers. Thank you so much. I've completed my questions, Dr. Cotton. Back to you.
Thank you so much, Dr. Johnson. Dr. Ivy Lee.
Lynise, I just want to indicate that your presentation was excellent. You're so comfortable with the information, and your presentation was so thorough and comprehensive. So it's hard to ask you questions. You did such a phenomenal job. But I do want to ask you, you indicated that you were a special ed teacher before, and now you're a
Martha Hall has joined the meeting.
was there anything in particular that fueled your passion for this study and your interest in this particular topic?
Yes, particularly when I first started teaching back in 2015 as a special education teacher, of course, not knowing what to expect. You hear stories, but then actually stepping into the rooms with general education teachers and also having self-contained classrooms, I saw that there was a major difference in the confident levels of the general education teacher and how they relied heavily on that special education teacher that was within that inclusive classroom to support the students who had disabilities or specifically the students with ASD. So the fact that they received the least amount of training in a climate where there is an increase with students with ASD in those general education classrooms kind of piqued my interest, as well as piqued my interest to the certification that I'm currently taking now for applied behavioral analysis, which aligns with uh, developing better behavioral strategies for educators within those inclusive settings.
Okay. Do you anticipate any difficulties in securing the participants for your study since they're in charter schools?
I don't anticipate any difficulties. I do anticipate, however, there might be some lack of honesty, I will say, because, people want to be perceived a certain way. But
Dr. Karen McDaniels has left the meeting.
I think with that, uh, there'll be a disclaimer of making sure that they know that this is anonymous so that we will have less of that.
Okay. How many actual schools will you obtain your participants from?
I've narrowed it down to about 2 to 3 schools just to decrease that population.
All right. Thank you.
Thank you.
Does that conclude your questions, Dr. Lee? Okay, I'm sitting over here trying to figure out how to turn this annoying announcement off.
Yeah, that's why I'm
Um,
pausing because I hear it when I speak.
I,
So.
I don't know where it came from. This is new. So anyway, maybe
Excellent answers, Lynise.
Thank you.
maybe Dr. Casey can tinker around, try to figure out what's going on. But all right, again, you did a phenomenal job with your presentation. It was very thorough. You were so comfortable with the content, and it's just obvious that you have become totally immersed in this research and in this experience. And so for that, I commend you. Um, Based on the literature that you have reviewed, what are the most common barriers to general education teachers uh, that they report when working with students with autism spectrum disorder?
The most common barriers would be that because it's a spectrum, every student is going to have a different behavior when it comes to socialization, when it comes to communication. And with the mandate of the least restrictive environments, that increased the level of having students with ASD within the classrooms. And because it's charter schools, sometimes there aren't special education teachers as well within the classroom. So now that general education teacher, being the primary instructor of inclusion, is now going to have to play a critical role in modifying those lessons kind of on their own, especially if they don't have that attitude or that behavioral attitude to seek feedback and to seek resources from other master teachers who have significantly been successful within that domain.
Okay, thank you for that. Let's talk about your methodology. How does the reliability and validity evidence of the ATTAS strengthen the credibility of your study?
It strengthens the credibility, especially when it comes to the validity, because they tested this study on over 2,000 participants, and they revalidated the study again in 2019. So after there were a shift in policies, after a shift in the increased amount of students with ASD are now entering that general education setting, just to make sure that it was still reliable and valid enough for the researchers to use.
Okay, thank you for that. One more question. You're using the snowball sampling to get your to get your participants. What are the strengths and the potential biases associated with the sampling method?
Some strengths with snowball sampling would be that It kind of cuts the red tape of having to ask for a permission from administrators. I will be able to use different platforms on social media where I know that these specific charter school systems have a lot of heavy participants and heavy activity, and some, you said some weaknesses, or
Uh-huh. Yes.
I guess the major
Or what,
one.
not weaknesses. I'm sorry, let me clarify. Strengths and then potential biases associated with the snowball sampling.
Some potential biases might be that since I have been an educator in New York for some time and within my 6 degrees of separation, I know of a lot of charter school staff members, staff members that might create some kind of small bias because they might want to respond in a certain way that they might think will help the study instead of responding in an honest way.
Okay, thank you for that. So that concludes my questions. And now we will go to the chair of this advisory committee and the chair of the department, Dr. Denise Charbonnet.
And thank you, Dr. Cotton. I do want to thank you, Ms. James, on an excellent presentation on your research prospectus. And I'd like for you to talk a little bit about something that is really important, because when we conduct research, we look for generalizability. And so you're working with charter schools. How do you think these research findings will generalize to the greater population of general education teachers who work in all schools, mainly the greatest number work in our public schools? So what do you think the generalizability of your research would be?
That's a great question, Dr. Charbonnet. I believe that because of this entrance level of charter schools having that high flexibility where they can implement professional development programs that can be beneficial for those general education teachers who need the support when it comes to students within with ASD. And once deemed successful, I do believe that there can be a buy-in with the greater traditional public schools and just other school systems, whether it be charter schools or, whether it be private schools or Catholic schools, right? I think it all has to do with the buy-in. So if they see that has been like a successful program, they see that a lot of the general education teachers are now maybe changing their tunes and the attitudes are starting to shift to more a positive realm, then that buy-in can increase on a greater level for that general ability.
Okay, thank you. What are some of the potential differences? Because you have criteria for your charter school teachers. Do you think these charter school teachers would be on the same bar with the teachers in a public school?
When you say the same bar, can you elaborate?
Credential wise.
Okay.
So I'm asking you kind of a loaded question, like the nuances between the people who might teach in a charter school as it relates to public school teachers, some of the differences here.
I think because this is focused on a charter schools in urban settings, it will definitely translate to public schools as well in urban settings. Just knowing that within that those geographic regions, these educators might have similar backgrounds, and these educators might have completed similar certification programs within similar schools, right, within that geographic region.
Excellent. So you are using charter schools, and I heard you answer earlier that you're looking at 2 charter schools, right? So
Yes.
how many teachers might that be who would participate in your study?
Yeah, so diving deeper into the research, there are about 65 to 80 general education certified charter school teachers within those 2 systems. And just based on the regression analysis, I need about 40 to 60 of them to participate.
Okay. You're replicating a study. What made you decide to do that?
When I First of all, when I decided that I wanted to focus on ASD or autism in the school setting, period, I started to look for some research and I found one that was closest to home because it was in New York. And I noticed that the researcher focused on K-2 educators. And with K-2, there are a lot of ASD interventions that are at play. And I knew that the attitudes or just the perceptions that the teachers might have would be different compared to high school, because once high school comes around, a lot of these students have more autonomy to say whether they want to go to intervention class or not, right? So I knew that there would be some differences, but I wanted to see specifically what the nuances would be with those 3 different subscales that are within the attitude instrument, that behavioral, the cognitive, and the affective subscales.
Great. One last question. I'm going to talk about the methodology and why do you think that quantitative was the best way to uh, approach getting the responses to your research questions?
So I decided to use quantitative because it allows for a larger group of participants to participate in the study. And when it comes to this particular survey, I appreciate the tri-component factor that it has, where it touches on the theoretical frameworks that I have. So within those 9 questions, it'll touch on implicit bias and it's going to touch on self-efficacy. So I knew that just all around the demographics as well with that minority piece and the survey itself was going to create a comprehensive research study.
Thank you. You've done a great job answering my questions, and I have truly enjoyed working with you on this prospectus. So thank you.
Thank you.
Thank you so much, Dr. Charbonnet. I see that Dr. Fulp joined us. Dr. Fulp, would you like to have any comments or questions for the candidate?
Thank you so much, Dr. Cotton. Thank you for having me. Oh my goodness, Miss James, hello.
Hello, Dr. Folk.
How are you?
I am doing wonderful. Thank you.
Good. I don't know if this is unprofessional. I mean, it is the proposal. It's not the oral, but I'm in here grinning like a Cheshire cat because because that was amazing. Gosh, I have so much to learn from Dr. Cotton and Dr. Johnson and Dr. Charbonnet and Dr. Lee. Job well done. I have zero, negative zero questions. Absolutely beautiful responses to the questions that you were asked. Amazing job thus far. And this time I grinned like a Cheshire cat. When you get to your oral defense, I'll be grinning like the Joker. So I'm looking forward to it. And again, this was an absolute pleasure. Job well done.
Thank you so much, Dr.
You are most welcome.
Dr. Fulp, you are so prim and proper. So in the neighborhood, we say Cheshire cat. You said
Right, right.
that was so cute. I don't, oh, Dr. Cutright, I'm sorry. Dr. Cutright.
Thank you, Dr. Cotton. Miss James, I was thoroughly impressed with your theoretical framework and your methodology. And I just wanted to make a quick comment before I ask a question. I just wanted to say, when you have a strong methodology, your chapters 4 and 5 will go really, really well. And I think you're on your way. But one question, I just wanted to ask you how you see yourself implementing the changes in the teacher professional development when you finish this dissertation and when you move on in your doctoral program.
So the easiest way that I would say that I see myself implementing it is by just using my resources, especially within that 6 degrees of separation. I know some administrators who are on the level where they create programs for their educators. So just using that opportunity to share with them that this is a study that is very meaningful and it will be meaningful to your instructors, and hopefully that there's a buy-in in that realm and then moving forward from there.
Thank you.
Thank you.
Thank you so much, Dr. Cutright.
Welcome.
I don't see, I know Dr. Jalem Hall joined us. I don't know if she's able to speak, um, but I just want to acknowledge her. There she is. Okay.
Hi. Hi. I do apologize. I missed a lot of your presentation, but I'm so excited to hear about a replicated study. So congratulations on that. And so given that you're using that replicated method, what about this study will add your contributions to it?
So this study adds new predictors, that minority piece. It also adds the self-efficacy piece. And because of those predictors, they kind of translate throughout that instrument, where now I can see the true nuances between the affective behavioral and the cognitive components of attitudes for these teachers, and to see those truly influence the different attitude shifts.
Mhm. So was that created through an additional research question? Is that how you?
Yes, yeah.
Great, great. Okay,
The original
wonderful.
study, the researcher did K-2. So I'm doing high school, which is a different ballgame when it comes to ASD within the classroom.
Absolutely wonderful. Thank you so much. I'm excited for you.
Thank you.
Congratulations.
Thank you.
Thank you so much, Dr. Jalem Hall. So I believe I have covered everybody. I see Dr. Springer is here, but I don't know if she's able to talk. Dr. Kaysen is not able to talk right now, but she sent her congratulations to you on your progress thus far. Um, so at this point, I'm going to open the break room for the committee room. So I'm going to open it. Miss James, I have assigned you to the break room, but you don't come right now. You stay, hang around in the main room. And once the committee has completed its deliberation, I will come back and get you, and you can join us at that time. So, colleagues and guests, you're free to stay and um, uh, di- talk with the candidate while the committee deliberates. Thank you so much for coming.
Dr. Wendy Cotton is the host now.
I was just about to say I thought we resolved that issue, but I guess not.
That's what you said, Dr. Casey.
How are you feeling, Miss James?
I am feeling wonderful.
You
I'm
can
really
breathe a sigh of
excited.
release for a little bit.
Yes, yes. My students sent me a video telling me congrats that right before. So that gave me a really nice charge.
How sweet.
Yeah.
How sweet.
Congratulations, Miss James. That was absolutely amazing.
Thank you so much, Lavina.
Super proud of you. I'm going to hop off, but I look forward to hearing what the outcome is. And hi, everyone.
Thank you.
Good morning, everyone. This is Dr. Monique Fordham. Congrats, Lynise. I just found out. And I'm so sorry.
It's okay. How are you?
You did an amazing job, and I am so, so proud. So
Thank
we
you
are
so
here
much.
rooting from you from Cali.
Thank you. Thank you.
Congratulations, Lynise. Oh wait, somebody changed my name. I guess I'm Dr. Kimberly Coward.
Hello, Dr.
It's all
Coward.
okay. It's all Dr. Kitson. I know it.
Dr. Cotton did that.
Okay. I am so happy. I was trying to get on. Karen sent me the link and it was all wrong. I went to Chat GPT. What is this link really supposed to be? But your you presented very well. Just like everyone said, it's clear that, you have, a command on it. So I hope I'm on the short list to see the next one because I know you got this, sis. Congratulations.
I appreciate that. Thank you. Cohort 14, let's go.
Yes.
Yeah.
I just wanted to thank you for setting the standard. I hope to be in this position very soon, and you have given me something to strive for. So I just wanted to say congratulations in advance. I appreciate you, and just keep moving forward because, oh my gosh, I'm excited to see what's next.
Thank you so much. Wow, thank you. I appreciate that.
Lynise, I'm gonna put my email in the chat so I could be invited part of the short list too to the next one.
All righty.
To your final that I know will be great.
All righty.
Monique, next time if I find out, I'm gonna share it with you. So, Lynise, are you still in? I missed the beginning. Are you in Atlanta or?
So I'm in DC now, DCPS.
Okay.
Yeah, public school system.
Okay. I think I remember early on there was in Atlanta, but it's been a while. It's in my memory.
Yeah, I did Atlanta for 1 year.
Okay, so that was quick.
Yeah. Yeah. Yeah, but I think I'm settling out here. I like it out here.
And I'm glad you're choosing this particular student group, especially secondary. That's my niche too. I'm glad that you're choosing this, and I'm excited to see the results.
Thank you. They definitely have a special place in my heart for sure.
Looks like you have a message.
Oh, wow. Thank you so much, Ms. Barbara Smith. Thank you.
Monique, but you over there, I'm retired now, so.
And busy as ever.
You're retired? Well, congratulations on that.
Thank you. I retired in December.
Awesome. Nice.
Yeah.
Where are you located?
Los Angeles.
Oh, nice. How's the weather now?
Hot.
Nice.
I'm about to hop off, but congratulations, Lynise. You did a wonderful job.
Chloe. Thank you. Thank you.
So excited to see somebody in the quantitative world.
Yeah. Thank you so much.
So best of luck and wishes to you, okay?
I appreciate you. Thanks. You too.
Thank you. Bye.
14 is coming through. Hey, Kel.
Yes.
We're representing.
Karen was on earlier. I don't know if you got a chance to see it. I know you were presenting.
Yeah, I saw her name pop in.
Okay.
See y'all.
Bye, Kels. Okay, Dr. Casey, we are planning to come to Hampton for graduation.
Not yet.
It's been moved to Friday this year, right?
No, the hooding or the big graduation?
We don't know about the hooding. The big graduation is now Friday.
Oh.
Okay, that's even better, honestly, for me. Okay, great.
Yep. So this will be first time in a lot of years that it wasn't on Mother's Day. We don't know if the hooding will be that Thursday. We don't know. So more information to come, but it is on Friday now. And it's also at the Coliseum, Hampton Coliseum, and not at HU.
Oh, wow. Okay.
So anybody that's staying at Embassy, it's ideal because you
as you saw, you could walk the parking lot. They share part of the parking lot.
Yes.
Yeah.
Let's
So
post it, Dr. Kaysen. Do we have a alumni email list or something?
are you getting emails anyway? Or are you talking about just for specific for the
Excuse me, Doctor. You can take your presentation down to Lynise. Yeah. All right. So we are ready for you, Miss James, if you will join us in the breakout room.
Dr. Fordham, were you referring to a HU ed management exclusively?
Yes, ma'am.
I don't think so, but I can ask with Dr. Jalem Hall. It looks like she's already signed off, but I can inquire.
Okay, yeah, we need to start one because we don't get the emails for the dissertation defenses and proposals. We want to be there. Hey, Dr.
Right.
Cotton.
Hey, lovely. How are you?
Good.
All right, I gotta go. Be back.
Yeah, because I know they send them to student email. So if you're not, I think I got my student emails even after I graduated. And I had all mine forwarded to my primary email. Yeah, so now I don't know.
There is some lists, like we get emails, but there's some lists we've been, removed from, and it was even before us. So, and whatever that list is when they announce.
It's probably based on who sends it, meaning who's sending the announcement, because Dr. Folk replaced Dr. Randall. Dr. Randall's now over in the Student School of Religion. And then sometimes they come from, I see her face, her name is escaped me, Dr. Dotson. So I don't know if they're using the same listserv when they send, but I can inquire about that as well.
Thanks, Dr. Kaysen.
But that would be good for you all to get them so you can continue to show up for your cohorts.
Absolutely, and for those after.
Absolutely. How many is left in cohort 14? Do y'all know off the top of your head?
Probably 30.
30. Wow.
We were 42, and I
I
know
don't think I realized y'all were that big.
we were like 42.
Yeah, I remember when they talked about it, they said we were pretty large, but we were that fall admitted, so
Yeah.
unlike the summer. So y'all were doing a new thing, I think.
Well, they had got away from large cohorts, but then I think they went back to it. But obviously they went back to it if y'all were 42, because we were 32 and we were cohort 1, and then cohort 2 was maybe 12. And then cohort 3 was even smaller, but that whole entire cohort 3 and 5 are 2 cohorts that every single person finished. But yeah, I think 3 and 5. But anyway, so sometimes they get a good mindset, like, no, we got it. Sometimes like, oh, we need to pull them back in. So, but I will definitely inquire about a alumni listing group, even if we have it somewhere that you all sign up to get them. So that way you can put in your preferred email to get the announcement.
And we can drop it also in our cohort group meet.
Right.
So that everybody could sign up like if it's a Google link.
Yep, will do.
So I'd like to ask if I can, because I'm admiring the community that I see here. How do you even know what cohort you're a part of, and how did you all establish and build that community?
Dr. Kaysen, you don't want to introduce us to the whole cohort family, so you'd be the best to start us off with that answer.
First, good afternoon, and I'm sorry, I'm looking at 2 screens over here, so if I'm looking away, please forgive me. Miss Outlaw, are the students in the program?
Yes, currently, yes. I just finished my last actual course in terms of the seminar and the financial.
Okay, so you just finished 39.
Yes.
So I'm
Okay.
guessing you were with Dr. Cotton. Is that correct?
That is correct, yes.
Okay. So your cohort is established by the group that you come in with.
Understand, yes.
And then a lot of, and mind you, Dr. Cotton and I are pre-COVID. So we kind of had to forge our way when we were still doing summer residency. We met in person, we got everybody's contact, we had Facebook groups and all that good stuff. And then everyone else after COVID has kind of started through GroupMe, and then they've kind of set their tone that way. I'll turn it back over to Dr. Cotton and I'll finish up in just a second. Dr. Cotton, she had a question about cohorts. We can finish talking to her when we wrap up. You're muted, Dr. Cotton.
Dr. Charbonnet, that's what I was giving it to her.
Well, we are so pleased to congratulate Miss Lynise James on her prospectus being totally approved. She has a pass, and we're ready to move forward with her IRB and her collection of data so she can continue on to her final defense. So congratulations, Lynise. You did a superb job.
Thank you.
And Miss Barbara Smith, thank you for joining us today. This is the sister of a classmate and colleague, Donna Graves, and she's in a program at Regent, and she wanted to see what a dissertation proposal defense looks like, and how wonderful that she got to see this one.
Yes.
So thank you, Ms. Smith, for joining us.
Yeah, thank you so much. Thank you.
All right. Well, thank you. Thank you, Dr. Kaysen, too, for your assistance. Dr. Coward, and who else? Who else am I missing?
Monique Fordham.
Oh, Dr. Fordham. There you go. I know some of our other babies are here. So it's so good to see y'all whenever we get to see you, Miss Outlaw. Thank you for so you know you're coming next. So all right.
Yeah.
All right. Well, have a good day, everybody. It's
Bye,
been
everyone.
it's been great. Thank you. Bye-bye.